Hello, everybody. I'm Dr. Stan Owen. That's O-W-E-N. I'm a medical doctor, and I'm going to tell you all about COVID-19, how you can reduce your risk of dying of this dreaded illness and reduce the risk of those you love of dying of this dreaded illness. It's not that terribly simple, and I'm going to explain it to you right now. Now, first of all, you don't know me from Adam. I've been in practice for 40 years. I'm board certified in internal medicine. I'm board certified in nutrition, and I'm also board certified in psychopharmacology. I'm an active emergency room physician, and all of that experience together over 40 years gives me a better insight to COVID-19 and how it's killing people than anybody I know. I've gotten more experience than anybody I know in the field of nutrition and especially diabetology as it relates to type 2 diabetes. So, why are obese people, diabetics, and older people dying of COVID-19? And younger people are relatively spared. Well, it's really pretty simple. Obese patients and diabetic patients and older patients are inflamed. They're making something called cytokines in excess that are injuring their tissue. COVID comes along, they have a host in an obese, diabetic, older person who is already inflamed, triggers the defense system, and the inflammatory system goes over the edge, causing damage to the heart, the lungs, the kidneys, the brain, really the whole body. And it does it through a very simple mechanism. It kills the little teeny tiny blood vessels all over your body because they're already full of hormones called cytokines, toxic cytokines, made by your own body, and specifically your own fat cells, that injure your organs. I've seen this for 40 years, and I've been able to explain it for at least 20 years. This is a poster that I made over 20 years ago, and it's a picture of a fat cell, and this is an angry fat cell, and this is the type of fat cell that's in your belly. If your belly is bigger than it was when you were a young person, it's because it's filling up with enlarged, angry fat cells. And these fat cells, when given the exact right type of foods, produce a myriad of hormones that we know are injury to the body. It kills your small blood vessels, it kills your organs, which is why diabetics have more heart attacks, more strokes, earlier kidney failure, as well as hypertension. And so as I come a little bit closer to show you this picture, the fat cell, when fed foods that are high in animal fats and carbohydrates, produce cytokines. Now, you may have heard of some of these, leptin, tumor necrosis factor, but there are lots of other ones you've never heard of. There are over 50 cytokines now that are made by the fat cell inside the belly that cause injury to your blood vessels, to clotting, to your metabolism, causing diabetes. And you see it more in patients with high blood pressure, aging, diabetes, and so forth. So how these diseases are connected through the fat cell has been known for quite some time. Like I said, I made this fat cell poster in 2002, and I've been talking to my colleagues about cytokines ever since. Unfortunately, nobody really was willing to listen because the answer is really altering your diet slightly. So I've been in the field of nutrition all these years, and I've seen results in patients in 3 days. Prior to knowing what cytokines were, I could not explain why I saw these results. They were often dramatic, marked reductions in blood sugar, marked reductions in blood pressure, marked excretion of fluid from failing hearts in 3 days, 7 days, a week, very immediately, and I could not explain it until we understood the science of cytokines. Because you can normalize and stabilize and reduce the level of angry inflammatory cytokines within 1 day, 3 days of changing your diet. And you don't have to change your diet radically. You can just change it with a strategy that allows you to have some fun, but not kill yourself. Now, some of you may not believe what I say. That's fine. Some of you may be health nuts and you already know it all. Some of you are rebels and you don't care what happens to you. And some of you are in the middle and you really do care and you really are willing to make some minor changes to help get yourself in a less risky position for COVID-19, and then later, after this dreadful virus is passed, actually take your health back. I have many, many patients who were on tons of medication, able to get off those medications. I can tell you personally, I'm old, I'm 68 years old. I've been exercising every day more than I usually have. I've been watching my diet a little bit closer than I normally have because I have to keep my metabolism and my defense system calm and uninflamed and in tip-top shape to fight off this virus should I get it. I'm in the emergency room, so I'm almost inevitably going to get this thing. I have to be in the best shape. There is no treatment for this. And in spite of all the hoopla you hear about vitamin C and hydroxychloroquine and Z-Pak, none of those really have shown to be of great benefit. And all hydroxychloroquine does is calm down the inflamed cytokine system that you already have. That's all that it does. It may work, but you can do it much better, much quicker, much more effectively with a change in your diet that I'm going to show you. Now, it took me 20, 30 years to make it this simple, but it's this simple. Listen very closely. Number one, you have to get liquid sugar out of your life. You have to get liquid sugar out of your life. Soda, juice, milk, and sweet tea. Diet drinks are fine. In spite of what health nuts will tell you, the science is very, very accurate and deliberate and robust that diet artificial sweeteners are dangerous. They are not. So Diet Cokes, Diet Juice, Crystal Light, Diet Sweet Tea, those are all fine to use. Milk, really not good for you, so just stay away from milk altogether. So that's number one. Number two, and you don't even have to see the lettering on this for me to get the message across. The foods in green and the foods in yellow are not going to harm you. The foods in red are going to make you sick. They're going to make those pro-inflammatory cytokines go crazy, and you can literally elevate those by 2 or 3 or 4 factors after one meal. So the foods in red are the ones you want to mitigate and reduce right now, especially, and in the long run, and increase your intake of the green foods and the yellow foods. So what does this little graph say from a distance? Well, first of all, the green foods, you can eat all you want. And the top one is, it says Prescript Fit Supplements. This is an amino acid product that I developed that you can buy in other varieties and brands around the country, which I'll tell you about in a second. And it is essentially branched chain amino acids. So they're broken down particles that go directly into your metabolism that don't require insulin to run your metabolism. So even if you're overweight and diabetic, these can bypass the insulin and get right into the nutrient defense part of your system and get it healthy quickly. After that is seafood, poultry, which is basically chicken and turkey, non-starchy vegetables, including yams, all you can eat, eggs, all you can eat. These foods are completely non-toxic, and in any combination that you want, eat all you want. In particular, nuts and fruit, whole fruit, really not so bad unless your diabetes is terribly out of control. I would hold the fruit until your diabetes is under control, which you'll notice a difference in 3 days. So the first thing is get liquid sugar out of your life, and really do that permanently. Don't do it just for this. Get it out of your life. It's not good for you. You don't need it. Increase and eat all you want of the green foods and yellow foods, and try and hold off the red foods to at least a total of 2 meals per week. Okay, 2 meals per week. You have breakfast, lunch, and supper 7 days a week. That's 21 meal slots. 2 out of those 21, eat all you want out of the red foods. So what are these red foods that cause your fat cells to be so toxic, make toxic inflammatory cytokines, and cause you harm, especially when you get hit by the COVID virus? Well, first of all, pork, beef, and dairy. Pork, beef, and dairy. Animal fats. Fats that come from animals. And not just by itself, but when you put them on top of a starch. Anything made from wheat, corn, rice, or potatoes, which is what starches are. Now, a lot of you, and I counsel patients all the time, don't know what's made out of wheat. So cereal, bread, pasta, snacks, pizza, anything made out of wheat. Corn is essentially cornbread, rice is rice, potatoes are potatoes. Some people say white or yellow kill a fella. But it's not the starch by itself. It's not the fat by itself. It's that combination of cereal and milk, bread and butter, rice and gravy, meat and bread, sandwiches, biscuits and sausage, meat and bread, pizza, cakes, cookies, snacks. It's that combination that's so toxic that causes the toxic cytokines to kill you. And without coronavirus, it kills you slowly. With coronavirus, it kills you in several days. All right. So all you have to do is really modify this, and you'll see those changes literally in 3 days. Those of you who have high blood sugar, watch your sugar come down. High blood pressure, watch your blood pressure come down. Swollen feet, watch the swelling go away. Low energy, watch your energy come back. You'll notice your mood is much better. And it's because these chemicals are not affecting your brain. They're not affecting your metabolism. And you can get them under control very quickly. So the first one, Prescripts Fit Supplements. You can go find these on our website at DRDIET.com, DRDIET, DRDIET.com. But you can also find branched chain amino acids in a big container at Walmart, at Target, at your local gym. Now the gym has amino acids like we do. They're called micronized amino acids. They can get literally, they don't have to be digested. They go directly into your bloodstream just like sugar does. They go directly to your organs and to your brain, and it does not require the action of insulin. But most of the micronized amino acid products, number one, you can find in gyms. Bodybuilders know all about this, by the way. Ask a bodybuilder, not your doctor, about the metabolism of branched chain amino acids. They'll tell you. Micronized amino acids, they are harder to find. Some that taste good. Ours taste fantastic. No prejudice involved, of course. And mix them with water. Don't mix them with milk. So all of the shakes that you want to make from branched chain amino acids, seafood, all you can eat, poultry, all you can eat, non-starchy vegetables, all you can eat, eggs, all you can eat of eggs. Very cheap, easy, tastes good. Nuts, all you can eat. If you have a bad heart, try not to eat the salty nuts as much. And whole fruit, not fruit juice, whole fruit. And try and minimize to 2 meals a week, pork, beef, dairy, starches. If you have questions for me, you can get me through my website. That's Dr. Owen at DRDIET.com, DRDIET.com. And my email address is there. I answer all of my emails. Just email me directly. I'll do the best I can. During this crisis, we're doing most of my patient care through email, so I'm a little backed up. But just put the question in, we'll find it. We'll try and help you. Listen to me. Listen to me. Listen to me. I promise you, in 3 days, you can reduce your risk of death. Help your parent, your elderly grandparent. Help them try and get their diet in order right away, because it can really make a difference. If I only save one person out there who listens to me, that's one person we've saved. Good day, good luck. Pray hard. Stick together. Keep your distance 6 feet or greater, as we say down here in the swamp, 1 alligator distance apart. And God bless you.